Welcome to Doctors on Call. I'm Jenna Miller. Around one-third of the estimated 21 million U.S. adults with major depression battle symptoms such as persistent feelings of sadness, deep sleep disturbances, low energy, and thoughts of death or suicide. They don't respond to treatment. People with major depressive disorder are less likely to respond to the first antidepressant they are prescribed. Victory Clinic is the first center in the Flint Hills region with 2 approved management options for treatment-resistant depression. Their purpose is to provide people with effective tools to achieve brain health, because to achieve optimal health, our brains must be healthy too. We'll look more into these issues on Doctors on Call with our guests, Drs. Kristie and Robert Clark.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Kristie Clark, the daughter of a disabled veteran, created Victory Clinic to bring integrated, innovative treatments to Junction City and the surrounding Flint Hills area of Kansas. Dr. Clark believes each of us have gifts, that a combination of mindful exercise paired with a creativity pursuit can lead to healing and health. Dr. Kristie, a graduate of Emory University School of Medicine, is a lifetime member of the Medical Honor Society Alpha Omega Alpha. Dr. Clark completed a residency in pediatrics at Children's Medical Center Dallas, University of Texas at Southwestern, and is board certified in pediatrics. Dr. Robert Clark, the son of a veteran, envisioned Victory Clinic. Dr. Clark's passion is treating difficult to treat conditions. Dr. Clark completed a Duke Visiting Fellowship in TMS and was the first Flint Hills physician to receive REM certification to prescribe Spravato. Acknowledging the power of neuroplasticity, Dr. Clark believes brains can heal. Dr. Clark, a graduate of University of Texas at Southwestern, is board certified in family medicine. He completed a residency in family medicine at John Peter Smith Hospital. Dr. Robert is a leader in healthcare, having served as chief medical officer of multiple health systems. He has expertise in caring for patients in the emergency department, hospital, clinic, and nursing home, as well as precepting healthcare students. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you guys so much for coming back. It's always a treat to have you here each year. So let's get started. First of all, let's talk about when are medications the best option for treating depression?
Well, anytime someone has depression that's really interfering with their quality of life, then at that point, medications may be a very good option for them. Medications can be life-saving. Medications don't work all the time, but in many people, medicines can help. Another time where someone might want to consider medications is if they've been trying therapy, talk therapy, and they feel like they're just not improving, then that might be a good time to consider medications.
Let's talk about what talk therapy is.
Well, there's multiple types of talk therapy, and so it almost becomes like a word salad. If you look it up, the DBT, the CBT, the EMDR, and these are all different types of therapy out there. It is very important to find a therapist who's right for you. And the number one most important thing about a therapist is finding someone who's really going to listen and hold that empathic witness space for you. And the nice thing about a therapist is they're not your family member, they're not your friend, they're not your coworker, and so they don't necessarily have an agenda for how they think you should come out and be. It's more that they're there to listen to you. But when it comes to the different types of therapy, I think it is important to, educate yourself about what are the different therapies out there so you find someone who is a really good match for you. So for example, CBT, cognitive behavioral therapy, is very good evidence-based for anxiety, and it helps reframe your thinking, works really well. And that's something I might recommend for someone who's very anxious and really wanting to reframe their thinking and their perspectives to help them overcome anxiety. For someone who's had a lot of trauma that they need to process, particularly childhood trauma, then EMDR, which is the eye movement desensitization, that might be something really good to help them metabolize and process the trauma.
And how quickly might a patient know? Like, can it be one visit that it's like, no, I need to find somebody else? How quickly can a person really realize that?
That's a great question. It really depends on every person. And so sometimes I think you've really got to follow your gut instinct on, is this person a good fit for me? And just like, not everybody's a good fit to work together or be in a relationship together. The same thing is with therapists. And so there's going to be people that they know after the first visit that this isn't a good fit. But most of the time we recommend try a few visits, because it usually takes a while for them to do their intake and get to know you. And so it might take several visits before you're like, oh, this person's really listening to me and I feel like they have some things to offer me that might be helpful. But definitely if things aren't going well and either that therapist isn't the right fit, then you may need to find another therapist, or you feel like the therapist is a right fit but you just don't see your depression improving, then at that point it's a good time to see a doctor and talk about if medications might be the right next step to help your depression.
And how does someone know, or their doctor, if medications are working to treat their depression or not?
Oh, thank you. You're doing a great job. I really enjoyed listening to you. But I really like the question about the timeline. And generally speaking, people are going to know when they get better. So if you're asking the question, am I getting better, you might be stuck. So we do have timeline expectations, whether it's therapy, medication management, or other treatments like TMS and Spravato. And the timelines are all about the same. And so it's super reasonable to try therapy, but it's also reasonable to expect to be about 50% better after 6 weeks and to be all better at 12 weeks. And the same is true for medication. So the expectation is you should be about 50% better at 6 weeks and all better at 12 weeks. You have to define what that is. And so, of course, we can ask, do you feel better? But I think it's more objective that we just hand the patient a scale that they fill out, standardized questionnaire, and it's a rating scale that almost everyone uses. The Patient Health Questionnaire 9, PHQ-9 is what we call it. The maximum score is 27. That's bad. You don't want a maximum score. You want a low score. We call all better or remission score of less than 5. So on your intake, if your score is 20, if our treatment's working, whether it's medication or talk therapy, at 6 weeks, you ought to have a score of 10. And at 12 weeks, your score ought to be less than 5. If that's not happening, we should change our plan.
Excellent. And sometimes a medication might work, but they have terrible side effects, or you're experiencing side effects. What does a patient do at that point?
So generally speaking, with medication management, you're going to fall into 3 groups. We give you a medicine and you get better. Fantastic. No side effects. Complete remission, score of less than 5. That happens. It happens 30% of the time. On the other spectrum, 30% of people are going to be non-responders. No side effects, no problems. It doesn't do any good. You're just not getting better. You're not responding. And then there's this middle third of people that are kind of partial responders. Maybe they're getting a little better, but maybe they don't tolerate the medicine, or maybe it's helping them, but there's some side effect, and we're asking them to take a medicine every day for weeks, months, years, indefinitely, and to tolerate a side effect. So it's just not a good fit for them.
And what are the most common side effects that a person sees?
So the most common side effects that we see in people taking oral antidepressants that are not tolerated well by the patient is weight gain. People don't like the weight gain that some of these medicines can cause. The other side effects are feeling numb. Maybe they're no longer having as many thoughts of suicide, which is a good thing, but they're not feeling pleasure as much either. And that numbness, some people will find intolerable. And the other thing we hear about a lot is libido, which of course, when their libido decreases, that can decrease someone's self-confidence. It can also affect their relationship. And then their spouse is complaining their libido's decreased. And so those seem to be the major side effects.
And maybe that's okay. Maybe the doctor can ask you to tolerate some side effects, but for how long? Because we're also asking you to take these medicines indefinitely. So again, the timeline's important. At 6-week mark, if you're not satisfied, don't keep doing the same thing. Change your plan, move on, get better.
If a person gets on a med, maybe to get through a trying time, is the hope that they will eventually get off that medication, or is it a long-term thing? How do you guys handle that?
You always hope you eventually come off the medicine. And I will say that. And there are definitely people that they're going through something difficult. They have depression. They find a medicine that works for them. Sometimes a genetic test will help them find the best fit for them. And then they go into remission and they're able to come off the medicine. That is absolutely best case scenario. What we see though is our thoughts changing about the model of depression and how we view depression as healthcare providers. And that is, a lot of people might go into remission, just like you might go into remission from cancer, but then later fall out of remission. And so definitely keeping track of somebody long term to make sure they're staying in remission and not needing more help is very important.
And okay, so we've been talking about medication, but can depression be treated without medication?
So, like we talked about, the goal is to get better. And realistically, we want to get you 50% better at 6 weeks, all better at 12 weeks. And it's reasonable to try talk therapy. It's reasonable to try medications. It's reasonable to do both. But if you're not responding, it's reasonable to move on. And medication is not a good fit for everyone. Some professionals aren't allowed to take certain medications. If you're pregnant, you might want to avoid certain medications. If you have other medical...
Or breastfeeding.
Yeah, or breastfeeding. Or perhaps you already are on other medicines that there might be some interaction that your doctor doesn't want to take a risk with. So there's a number of settings where we need to do something other than medication management. And as it turns out, there's good reason for that. If you're a non-responder to medication, we need a strategy. So the FDA approved and cleared strategies that are safe and effective with a high probability of remission are TMS and Spravato. There's a few other treatments out there, but they're more invasive and they have more risk. Those are ECT, deep brain stimulators, and vagal nerve stimulators, but those are generally invasive procedures.
TMS was FDA approved in 2008, so it's now been a while. And Spravato, which is nasal S-ketamine, was FDA approved in 2019, and next month it will have been approved for 6 years. So it's been out for a while too. And both of these medications are FDA approved, indicated when someone has tried 2 or more different medicines from 2 different classes and they have failed to go into remission. So the bar is pretty low. By the time people sometimes find us, they maybe have tried 7. We've seen as many as 30 medications where they've tried almost everything. But really, the insurances that cover these treatments, a lot of times they'll cover them once you just have been failed by 2 medications. Because at that point, it's unlikely you're going to get better if we try a third.
Okay, so can you explain what the difference is and how they work, what TMS is and what Spravato, and how those two work?
So we're just going to change the way we understand the brain. And we now know that the brain is like any other organ, and it wants to heal. And you can see on an MRI, called a functional MRI, brain activity and brain connection. And what it looks like depression is, or anxiety, or PTSD, or other mood disorders, it's this brain connectivity pattern that you've fallen into, probably because of repeated stressors over time. And your brain finally gets to the point where it kind of wants to short out to kind of maybe protect you from some of this trauma and stress. And the result is always very predictable. And that is your executive function, which is right here, your left dorsolateral prefrontal cortex, kind of turns blue. And this means you don't have ambition, motivation, you don't want to do the dishes, you don't want to do the laundry, you don't feel like getting out of bed, you can barely go to work. When you lose your executive function, what you're experiencing is depression. And so one way to get you better is we just wake that part of your brain up. So how do we do that? We just convert electric energy into magnetic energy. Magnetic energy is completely safe.
No radiation.
No radiation, no toxicity, and doesn't hurt. And then we can target that part of the brain and give you a stimulation. That part of the brain re-engages, wakes up, your brain reimbalances. and you feel better. You get your charisma back, your energy back. Decisions that you didn't want to make certainly become clear. Things that you previously felt overwhelming, like taking a bath, you start doing, and it's actually a lot of fun. Spravato is a chemical reset. So TMS is transcranial magnetic stimulation. It's a targeted treatment. Depending on the number of treatments, depends on the remission rate, but highly effective. Spravato is kind of a chemical reset. If you take it by mouth, nothing happens. So our little trick is we do a nose spray. 10 minutes later, your brain kind of resets. The medicine's out of your system in 1 to 2 hours, and you feel better. Again, rebalancing your brain chemically.
How long does a TMS session typically last?
It really depends on the TMS unit. We have the MagVenture in all 4 of our clinics in Kansas, in Manhattan, Lansing, Leavenworth, Junction City, and Dodge City. And we can do theta burst, and that can give you a treatment for both depression and anxiety in under 5 minutes. Some of the older units, they can run a similar protocol to ours, but it takes an hour. So that's one thing we pride ourselves in, is we have the best technology in Kansas, and we can do really fast treatments, which if you're a busy working mom and you have to pick kids up at school, you'd rather come in and do a treatment in 5 minutes than an hour. The insurance companies approve a treatment a day, so Monday through Friday, for 36 treatments. Spravato is induction of twice a week for a 2-hour observation time. Someone has to have a driver, so it takes support from family and friends to do these treatments, and it's twice a week for 4 weeks. And then it weans out to once a week. And then from there, depending on how someone's responding, they may stay once a week, or they may go to every other week and get spaced out further. It all depends on how someone's doing. So they're very different treatments in terms of time commitment. But when someone comes in and they have treatment-resistant depression and they've tried medicines and medicines don't work, or they're a category of people like a pilot or a pregnant mom that it's best to avoid medicines, then we're trying to find which of these treatments is going to be absolutely best for this person, depending on also their medical history. And in some cases, people can qualify for combination therapy with both together.
Excellent. All right, a lot of good information. We're going to go to the phone lines now. We've got a caller from Derby waiting to ask a question. Hello, you are live on the air with Doctors on Call. What is your question tonight?
Hi. My grandson has been on medication for about 20 years for depression, various kinds of, and I've been interested in finding out about this ketamine. He was moving toward the idea of using ketamine and with the doctors and, supervision and everything. But then the federal FDA was putting up cautions, and so now he's backed away. It seems to me that there's some good idea for him to try the ketamine, because all of these nothing has ever actually gotten the depression, and most recently he's been even having very negative, almost suicidal language. Is there anything that can be, you can tell me about ketamine? Is it, how is it used? Is it FDA approved, and does it it's used in the office with the doctor, is that right?
Thanks for asking this question for your grandson, and I appreciate this grandmother and really cares and is really trying to help research what might be a good treatment. Spravato is a nasal spray that's FDA approved for treatment-resistant depression, and it sounds like this person she's describing has treatment-resistant depression and has been struggling for years and tried medicines. Spravato is nasal S-ketamine, and so that is just a purified form of ketamine that has been studied and is FDA approved. And if this sounds like a treatment that might be helpful, then the best way to find a Spravato provider would be to go to Spravato HCP for SpravatoHealthcareProvider.com, and you can go onto Spravato HCP and put in your location or your zip code and find a provider who is Spravato room certified. So in order to be able to give this medication, which is FDA approved and covered by many insurances, the doctor and the pharmacy involved also has to be certified. And so this is a very good question. The question was about ketamine, but I would definitely encourage in this case, it sounds like we're dealing with someone who may qualify for Spravato, which is FDA approved and covered by many insurances. So I would definitely look for a provider on the SpravatoHCP.com website who might be able to help. And if TMS sounds like an option, maybe TMS is an option too. Then you can always research TMS providers in the area. Now, sometimes you'll find a provider like Derby's in the Wichita area. There's a lot of physicians in the Wichita area that are doing Spravato. There's some that are doing TMS, and there's certainly some that are doing both.
Does a patient, if they decide they're going to try one or the other, do they ever start by doing them both together, or do you usually try one or the other?
Occasionally we'll have a patient that is severe enough that we think they look like they qualify for both, and their insurance creates a pathway where they can have both. Now, sometimes we're looking at someone thinking, wow, they sure would benefit from Spravato and TMS, but their insurance company says, well, you have to choose one. And then in that case, you choose the one that you think might work best. I do want to address, the caller was asking about ketamine. And ketamine is a very old drug. It's generic. It doesn't have an FDA clearance for depression, but we know it works for depression. It's been very well studied for depression, which is how they came up with the idea to purify it to make Spravato, which is FDA approved. It won't ever be able to be FDA approved just because it's generic and so old. There's not enough money in it for any of the drug companies to pick it up and approve it, but we know it works. The problem, though, with it not being FDA approved is then insurance doesn't cover it in a lot of cases. And so for people that are worried about funding, if it looks like maybe their insurance would cover Spravato, then that is a very good way to go. The other thing about Spravato is it's nasal. And so you don't have to get an IV to get Spravato. So it makes it easier to deliver for a patient. Definitely more comfortable.
Yeah. Okay. Wonderful. We wish this caller luck with her grandson.
Definitely.
Absolutely. So previously we've talked about genetic testing for medication metabolism. Is this testing still used for people who need to start a medication?
Knowledge is power. The genetic testing has really good evidence, and it's very useful for the physician and the patient. I think sometimes, though, physicians are reaching for it at the wrong time. So
Too late?
Too late. So the first time you try an oral antidepressant, the probability of response is really just 30%. The second time is about 20%. The third time is closer to 15, maybe 10%. So it's diminishing returns. So if you already tried 4, 5, 6 medicines and now we're doing the genetic testing, it may not have a lot of value. In some cases, though, you are responding, but you're having side effects. So now I can do a genetic testing and refine our choice so that you get the fewest side effects with the most benefit. And then other times we get patients who aren't getting better. So the physician's trying to help them by combining medicines. So they might be on 1, 2, 3, 4 medicines in combination, but they're not really getting benefit. And then doing the genetic testing helps you kind of say, look, you're not even metabolizing this medicine in a useful way. Why don't we discontinue it? So it can be very useful, but you do have to have some experience as a physician to guide the patient through it.
Ideally,
we do it the first.
we would do it before we started a medicine, as long
100%.
as someone's stable enough, because it takes the medicines for depression 6 weeks really to start working, 3 months for full effect. So if you think of how long it might take to know for sure if that medicine's working or not, it would be best to start the process with as much information as you can in order to pick out the best medicine that might have the best chance of working for someone.
Sure. And we have just a few seconds left. Let's talk about what a family or friends should do when a loved one is in crisis.
Most important thing is listen and hold space for that person and not try to give them advice, because just listening a lot of times can de-escalate the situation. Definitely don't leave them alone. Stay with them, keep them safe, remove any lethal means, And if you need help, don't hesitate to call 988. That's the new crisis lifeline. And the people there are trained in a way that 911 isn't trained. I mean, 988 is specifically trained to help in a crisis situation. So don't ever hesitate to call them. There'll be someone there who cares, who will listen, and who will help.
Absolutely. Well, thank you again so much to our guests tonight, Drs. Kristie and Robert Clark from Junction City. Our next Doctors on Call will be discussing cardiology with Dr. David Batten from Salina Regional Health Center. You can email questions to us for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.